to Invest Insights. I'm Abby Maloney. I'm joined today by Dr. Howard Schwartz, the partner of My Psychiatrist. Howard, thank you so much for being here today.
Thank you for having me.
Let's dive in. You've been practicing medicine for the past 30 years, and it's safe to say you've had a wide variety of experiences. What is one defining experience that has had a long-lasting impact on your work, and how have you used it to creatively approach your current role?
Being a physician is a privilege, and I've been privileged to practice medicine in South Florida for 30 years. And doing so, you learn something new every day. I think the biggest thing that I've learned over the past 30 years is that everybody is an individual, everybody has issues, and everybody deserves the best medical attention available to them.
Howard, obviously we've seen the pandemic present the most difficult challenges, and now there's an increasing demand for psychiatrists with an even wider demographic of individuals and needs. With so many specialties and services, how have you been successfully and creatively expanding your outreach to support each demographic of patients, considering this virtual transition?
So psychiatry is kind of an interesting field. Many years ago, prior to Obamacare coming in, mental health was not treated the same as other diseases. But with Obamacare became parity. So diseases, mental illness became treated the same way as cancer and heart disease. And I think that what the pandemic has done is accelerated that. And so we at My Psychiatry, recognize we actually, Dr. Ventry started the company in 2012. And with Obamacare a couple of years later, psychiatry and mental health came with parity. And so with that, we've been preparing for the growth of mental health treatments for the past 10 years or so. And with the pandemic, that's accelerated quite a bit. Before mental illness, psychiatric illness, daily stresses, anxiety, and depression were kind of frowned upon. Some people were embarrassed to talk about them. Most people didn't seek help. It was kind of taboo. And I think the kind of what the pandemic has done and the acceleration is that dealing with somebody's mental health is just as important as dealing with other physical health. Their heart, their lungs, their brain are all interconnected. And so that mental health is kind of caught up with the other organ systems of the body.
Howard, adopting a preventative approach to healthcare has become an effective strategy to reduce the burden on emergency services and improve the overall performance of healthcare systems. How can preventative healthcare be used as an innovative approach as it relates to mental health? And how is this reflective in the services that your organization offers?
So our company, My Psychiatrist, its goal is to offer our services to people that have mental illness, as well as daily stresses in our lives in South Florida. So kind of mental illness sometimes can have a negative connotation associated with it. All of us have daily stresses that affect how we perform. Is a daily stress a mental illness? Maybe not, but if left alone without addressed, it could certainly lead to more serious consequences. We all have challenges and ups and downs in our daily lives, whether it be professional, in our relationships, with our families, children, parents, significant others. And it's very important that we appreciate that those relationships and our own energies to have a stable outlook on life prevents mental illness. Lots of times something starts as something quite trivial, but then kind of lead ourselves down a pathway. So at My Psychiatrist, we encourage individuals to make this a part of their general well-being. Lots of times you'll hear people, I exercise for an hour a day, or I do other activities that are going to help myself, or people spend time on their hair or on their nails or their physical appearance in a store. But taking care of yourself and making sure they have a good, organized, focused mind really allows us to think clearly and allows every part of our life to be more productive and more satisfying. We always kind of recommend people to kind of come up with tricks or things that would make it work for them, to spend 5 to 10 minutes a day just to kind of sitting back and away from all the bombardment of kind of the text, the emails, the internet, and so forth. We recommend to our patients to take 5 to 10 minutes on the weekend to kind of write in a book or on their pad or on their phone, a list of kind of things that they need to kind of do for the week, and their priorities for that week, and try to make sure that they achieve those. And then as the week goes on, take 5 minutes a day to either add to that list or subtract to that list to make sure that we can accomplish our goals during the course of the week.
And as we round out our discussion today, what are some unique ways that you're fostering creative thinking across My Psychiatrist now and in the future?
So My Psychiatrist is a team of 11 psychiatrists, 20 psychiatric nurse practitioners, and 15 therapists, some of which are psychologists, some are licensed social workers, but all licensed therapists. And we meet regularly to discuss the challenges, opportunities, and new ideas for which we can kind of bring to our patients. We're very proactive in discussing anything that we can do to make a difference in their lives. And we very much advocate, in addition to medical therapy, we advocate people try to come up with tools to self-help themselves on a daily basis. In addition to that, we're very innovative and progressive with any new treatments that become available. We offer TMS, transmagnetic cranial stimulation, which is a non-medical form of treatment for depression, resistant depression, anxiety, bipolar disorder, addiction disorders, and actually for smoking cessation. And we offer new types of psychedelic therapies or ketamine therapies, and the recently approved Spravato therapy in our offices. So we're always looking to give our patients the most options for treatment, whether it be through telemedicine, for local visits to one of our 4 locations available in Dade, Broward, Palm Beach County, as well as telemedicine throughout the state of Florida.
Well, mental health is truly important. So Howard, I thank you for today's discussion.
Great. Thank you, Abby.
That was Dr. Howard Schwartz, the partner of My Psychiatrist. If you enjoyed this video, don't forget to like and subscribe to our channel to hear more CEOs and thought leaders share their opinions and advice on today's business climate. Until next time, I'm Abby Maloney, and this has been Invest Insights. Thanks for tuning in.